Hello, hello, everybody. I hope you can clearly hear the audio. I'm trying my best with the audio. But as you can see, it is a sunny day today. It's a beautiful day by the park. I'm actually by the Hudson. Unfortunately, I couldn't turn my camera because it's somewhat placed in the steering wheel, so it would be hard to do that. But I do want to fairly quickly go over tuberculosis today, right? As we all know, tuberculosis is a very important topic that you will most likely encounter in your exam, right? As we all know, it's a pulmonary infection. It's caused by a droplet nuclei, usually the tubercle bacilli, right? Or it could also be the Mycobacterium tuberculosis, which is a gram-positive bacillus, right? And um, you'll encounter tuberculosis a lot in your NCLEX exam. It's a fairly common NCLEX disease, right? And when we assess our patients, of course, we're going to see dry cough, night sweats, right? Fatigue, some malaise. And in the later stages, or what we call advanced stages, we will encounter some hemoptysis, right? Which is basically blood in the sputum, right? And an important thing that we have to be aware of is that diagnosis usually is a chest X-ray. Sputum culture can also be done. Sputum culture would show a positive for acid fast bacillus, right, or positive for the Mycobacterium bacillus. And we could also do the Mantoux skin test, right? And majority of these patients, we will encounter an increased in WBC. Okay, so again, when we're looking at the diagnosis, we're looking at first doing the tuberculin skin test, the Mantoux test. We could also check if the skin test is positive. We could also do a chest X-ray just to make sure that the patient is not a negative positive, right? And we can also, lastly, we could also do a chest X-ray, and we could do a culture of the sputum for the patient, right? Just to make sure that the patient really is positive for tuberculosis. Okay. Now, I want to go over the main drugs that you do have to know for your NCLEX exam, and those main drugs, basically the anti-tubercular drugs, which is basically antibiotics, are isoniazid, which is INH, rifampin, and pyrazinamide. So those three drugs, as long as you know those three drugs, those are the main three ones that you do have to know. Again, isoniazid, which is INH, rifampin, and pyrazinamide. Okay. Now you could actually do a combination of those drugs, rifampin, isoniazid, and pyrazinamide kind of combination to really make the treatment more efficient, more effective, right? So again, isoniazid and pyrazinamide and rifampin are the most common drugs, right? When we're looking at isoniazid, the side effects can include diarrhea. There can be some vision problems, and understand that it's very hepatotoxic, um, hepatotoxic for the patient's liver. So you do have to be mindful when giving all these medications. Now, the only thing that you have to realize with rifampin is that it will have the urine of the patient can have some red discoloration, right? Or the sweat or the tears of the patient. So just let them know that there will be some red discoloration within the fluids. Also, be careful because the contact lenses might be permanently stained with the discoloration of the tear. So you do have to be mindful of that. With pyrazinamide, it is also hepatotoxic, but it can also cause hyperuricemia. So you do have to be mindful of that. So I think that's it, guys. I just want to fairly quickly go over those three main drugs, which really, is the most important things that you do have to know for the NCLEX exam. All right. Also, try to know the doses, the normal doses, and And I think that's it, guys. I hope you guys are hope that your reviews are doing okay. I'll be doing more of the notes, showing the notes kind of review in the next few videos. And this one, I just wanted to make it nice and short. So I will talk to you later.